I will be going over the extraction tray setup. You should always have your topical placed on your tray to numb the tooth you are working with. You will then have your local anesthetic to inject the patient's mouth. After the anesthetic, you will rinse and aspirate the patient's mouth. Then you'll use the HVE to take any liquids coming out of the mouth, including from the air water tip. You will also have a mirror to have the doctor look at anything in the mouth that is hard to see with the eye. You must continue having the basic tray set up onto the original extraction setup. This will include your explorer, so you can check around the mouth and explore any unusual sights in the mouth. Then you'll have the perial probe, the cotton pliers to be able to pick anything up without cross-contamination. You will then add the surgical suction. It will have a smaller tip to get into the surgical site and will be placed where the HVE is placed. You will then transfer the periosteel elevator to separate tissues from the tooth. You will have gauze ready to remove blood or debris from the instruments when working next to the doctor. The cotton rolls will be for isolations throughout the procedure. After maintaining operating field, adjusting the light, and retracting the tissues, you will go ahead and transfer the straight elevator to loosen the tooth from periodontal ligaments, and then transfer the correct forceps to the operator for removal of the tooth. This will be a bite block on the tray. These will be our elevators. We have a small and a large. You would use them one at a time. The small separates the tissue and the large lifts the tooth out. This is a periostal elevator. It's used for retraction, hold backs the tissue. Then we have the hemostat. It's used to control bleeding. We do have surgical scissors on our tray to cut off anything that is loose in the mouth. Here we have another set of hemostat. It's probably to perform on a different size tooth. This is the sutures that are placed in the mouth. Every doctor would use a different type. It just depends on which tooth you are working on. Here we have more instruments to be able to be used on the extraction. We have the Rogers on the first one. Second, we have the list goes on different instruments to extract teeth. It depends where you are working in the mouth for the tool that you'd like to select for the procedure. On this specific photo, you can see here that it does come with a surgical blade, surgical HVE. This specific tray includes the bone file. On this one, it does include the curette as well, plus the rest of these instruments. After the instruments have been picked out, you can now start the procedure with the doctor, and after make sure to say the right post-op instructions to be able to take care and make sure they take their medication